Just integrative medicine specialist here live in an operating room, especially on Veterans Day, because veterans and PTSD unfortunately have a lot in common, and it's something that I have to help my patients with in the operating room all the time. And it's no surprise that anesthesia can actually cause PTSD in surgery when someone's on the operating table like they are here. Anesthesia can also fix PTSD. And I want to just take a couple minutes here to talk about it, given that it's Veterans Day, and of course for all the service that veterans have given to our country. Whoops. I see people trickling on. That's awesome. We're going to dive right into it because there's so much about PTSD that we understand and a lot that we don't yet understand, and especially what anesthesia has to do with it. First and foremost, hey, Kaylin is coming on. I love it. I'm happy you made it onto the live this time. English language, learning arts, hello. So the first thing about PTSD, whether you're a veteran, whether you're in a war, or whether you're in the operating room with me, when memories don't get consolidated correctly, it's a buildup for PTSD. What does that mean? It means that when someone has PTSD, if you ask them about the experience, whether it be the battlefield, on the table, with the doctor, doesn't matter. If they have hyper vivid memory of that, they can smell the same smells, taste the same tastes, their heart rate goes up. You know, even if you're connected to a monitor or not, doesn't matter. People will feel the sweaty palms, what we call hyperarousal. All of these symptoms come up when you're reliving the memory because the brain has not normally consolidated the memory. So when the brain retrieves the memory, it's reliving the experience. So we believe that traumatic experience does not get consolidated like any normal memory. If I asked you what you ate for breakfast this morning, you probably wouldn't have that same vivid recollection of, oh, the cereal tasted like mouth-watering, waffle, crisp, whatever, right? So PTSD, fundamentally different. Now, when you're under anesthesia, this is where things get a little trippy, and you'll see how it's related to the battlefield. When you're under anesthesia, you may have an experience that your body feels, whether it be your heart, your muscles, anywhere in your body, but your brain has the amnesia, so it doesn't remember that it had that experience. This is really trippy, right? Because it's like, what is consciousness? Well, this guy here might be backwards. It's called midazolam, also known as Versed. It causes anterograde amnesia. And it means that you're not going to remember what happens. Your body's going to take score, but your brain won't remember it. So it's not going to be consolidated normally. When I have patients coming into the operating room, and if they have a little bit of anesthesia awareness, but they have that medication on board, they may not remember what the traumatic experience was, but their body will. And that can bring up traumatic, like PTSD symptoms the next time they see a hospital, or they see somebody in a hospital gown, or maybe they see even a video like this of, you know, operating room lights, the anesthesia machine, the monitors, the medications, someone in a white coat. All this white coat hypertension has many reasons for it. The problem is that unlike somebody in the battlefield who might know that it was the shrapnel that whizzed by my face that killed my friend, that as being the traumatic experience, these patients don't know that they may have had a little bit of anesthesia awareness on the operating room table. There's another one here, by the way, as well. This is a different table. This is the one that you go face down in for spine surgery. Lots of different tables in the operating room. And they're not going to be able to pinpoint what the inciting trauma was. And that's what makes it so different than other types of PTSD, anesthesia or surgery PTSD versus other types. So this is a reminder here. These things come up in the body because the body keeps score. It's why my clinic in San Francisco, I saw Brenda ask, in San Francisco, when I help patients that are going through these experiences with sub-anesthetic or low doses of anesthesia, whether it be ketamine or other types of anesthesia, we can help these memories reconsolidate. Hopefully we can figure out what the traumatic experience was, what that memory was that didn't get consolidated correctly, help it reconsolidate, and we use things like anesthesia to help soften the blow of that memory coming up. I use things like beta blockers. I don't have any on me right now. Propranolol is one. So that when that experience is relived, the beta blockers or that sub-anesthetic dose of anesthesia prevents the body from going into hyperarousal mode. So when you go into hyperarousal mode, we can see on the monitors, we see the heart rate go up, the heart rate variability go down the drain, the respiratory rate go up. All these things happen in the body that we can observe, but we can also mute with the medications that we give. So if we can help in a very carefully guided way, help patients relive the experience, whether it be from a phobia, whether it be from reliving the actual thing through an exposure therapy, if we can attenuate the body's response with anesthesia or beta blockers or a very powerful guide, often psychedelics, with that guide, that's how I do it in San Francisco, right? We can actually see the monitor have very different symptoms, meaning that the body is responding differently to the experience this time. That is the start of that memory reconsolidation in a healthy way. So I haven't caught up with all these comments here. Thanks for everyone for the comments. Michelle says, this is why I've had nightmares since childhood. The stuff happened before I could remember. Michaela, pardon, I'm so sorry that you've experienced that, but you nailed it. This is where adverse childhood experiences kick in. Have you all heard of ACEs or ACEs? It's from things that happened before our memory, our long-term memory formation has really kicked in. Exactly, you nailed it on the dot. What else? Enola Holmes says, this man should be more popular. Hey, Enola, that's so kind. Thank you so much for sharing that. I always appreciate it when you all share what you learned with others. If you hit that like button, subscribe to, keep up with all my lives. But at the end of the day, I want you all to learn something, to know what your healing potential is. Remember, these medications that I give in my clinic in San Francisco through ketamine, or if I'm guiding somebody on the operating room table in this scary room, you're doing the bulk of the work. You are healing yourself through your potential. I'm simply facilitating. I'm just greasing the wheels with anesthesia, biofeedback with the monitors. It's really you all doing it. I'm not anything special. You are just learning about your body and how you can have more control than you've probably ever been told. All right. So what else have we got to catch up with? Hey, Brenda, thank you for the kind comments. Faye Art, great to see you from Michigan. And Michaela says that you just taught me why my PTSD flashbacks went away once I started beta blockers. When you got sick. Well, Michaela, I'm sorry you got sick, but I'm so happy that you were able to crush your PTSD flashbacks. This is amazing. Kaylin says, I've been learning so much from you. I'm going for surgery consult next week. I was most worried about the anesthesia, but now I'm not that much. Hey, y'all are crushing it. And Jason, thank you. Thank you so much. Let's get one more question in. I have to get back to some things in the operating room, but I would love to leave you all with positivity. Michelle Meissner. Michelle, thank you for reaching out. I've been trying to get in touch with you over Video MD. I don't know why there is that giant glitch in this system, but I owe you a video and it's coming up. She asks, what can we say to an anesthesiologist to get max PTSD healing, but not go into trauma under anesthesia? So Michelle asks such a powerful question. What is the balance between having a PTSD experience that you're reliving, which is dangerous potentially, versus healing? If you don't have the right guide, it's going to be difficult. But the general premise is to make sure the patient or the client they know they're in a safe and comfortable environment. So you can't always control this physical environment. So for example, if I have a patient who is having surgery, I can't control the operating room. I can't control my scrubs or the different colors that are in here for the sterile drapes and all that. However, I can control the other parts of that patient's experience. Their interaction with me, with the nurses, with the scrub tech, with the surgeon. When my patients know that they are cared, loved for, and guided, when they can trust everyone who is helping them through whether they're reliving a PTSD experience or going through a new experience in surgery. That I find is the single most important part to guiding a healing experience with anesthesia, whether it be ketamine, propofol, even the anesthesia gases that I've shown you before here that we spin up and down. That's why I call my patients the night before. It's why when they're on the table here with me, if it's the right patient, everything else is right. I remind them before they fall asleep that they are the most important person in the world to me and everyone else in the room for the next hour or two or however long their surgery is. Because should they have recurrence in an unmanaged way of that traumatic experience, knowing that they are in a safe place with people that they trust from the bottom of their heart, cerebrally and in their heart, right? We know they're connected, the vagus nerve, etc. That helps tread that fine balance, Michelle. I hope that answered your question. You all have more power over your health than you've ever been told. I look forward to seeing you guys next week on Monday. I hope everyone has a good weekend, and I hope everyone has a good weekend. And I'm actually going to be publishing, hopefully this weekend, a really powerful video on Ayurvedic medicine, so be sure to check that out. And Michelle, my pleasure. Thank you for that awesome question. Until next time, guys.